Have you ever gone to the ENT for a sore throat, only to be told that everything looks perfectly normal? It's incredibly frustrating when you're dealing with a constant feeling of something being stuck in your throat or discomfort every time you swallow. Believe it or not, the real culprit might actually be your jaw. When doctors can't find a clear cause for these throat issues, they're often closely linked to TMJ, or jaw joint misalignment. So how exactly does your jaw affect your throat? I'm going to break down the science behind it in a way that's easy to understand. If you've been searching for answers without any luck, let's take a look at the root cause and finally find a solution that works. Your jaw and throat are closely connected by a complex network of muscles. It's not just the muscles we use for chewing. There are also muscles linking your lower jaw to the hyoid bone, the small bone right above your Adam's apple. And from there, they extend all the way down to your chest and shoulder blades. Because everything is so interconnected, even a tiny shift in your jaw's position can cause these muscles to be pulled too tight or become over-relaxed. This chain reaction of tension puts a lot of strain on your throat, which often leads to pain or a persistent feeling of discomfort. Ultimately, a misaligned jaw isn't just a mouth issue. It's a major factor that can throw off the entire muscular balance, from your neck to your throat. The key to understanding that strange discomfort in your throat is a tiny bone called the hyoid. It's the only bone in the human body that isn't connected to any other bone. Instead, it just floats there, held in place by muscles. This makes it incredibly sensitive to the balance of the muscles around it. If your jaw is misaligned and pulls on those muscles, the hyoid bone gets dragged out of position. When that happens, the muscles you use for swallowing and speaking can't work smoothly, leading to that annoying something stuck feeling, or even pain. A bone that's meant to move freely loses its place because of a misaligned jaw, and that is the hidden cause behind throat issues that are so hard to find in a typical exam. Throat pain caused by TMJ follows a very specific pattern. Unlike the sharp, sudden pain you get with a cold, it's usually more of a dull ache that lingers for weeks or even months. Even if it seems to clear up for a while, it often flares back up when you're tired or overworking your jaw, and it has a tendency to become a chronic issue. So if you have a sore throat that's been dragging on, or one that keeps coming and going, it might not be a virus or bacteria at all. It could be a sign that your jaw is out of alignment. If you've been dealing with this kind of unexplained pain for a long time, it's definitely worth looking into the health of your jaw. Ever feel like there's a lump in your throat, or maybe a tight, squeezing sensation? These are actually common symptoms caused by a misaligned jaw. When your jaw is out of alignment, the muscles around your neck stay constantly tense and stiff, which restricts blood flow to the lining of your throat. This can make the area hypersensitive or make the inside of your throat feel swollen. That's the real reason behind that stuck feeling, even when there's nothing actually there. The extreme muscle tension is putting pressure on your throat, creating that uncomfortable sensation. If left untreated, this can lead to difficulty breathing or even intense anxiety, so it's important to address it early on. The human head is surprisingly heavy. It weighs about 13 to 17 pounds, which is roughly the same as a bowling ball. To support all that weight on such a slender neck, your jaw and neck muscles work together in a delicate, perfect balance. But if your lower jaw gets out of alignment, that balance is thrown off, and your head is no longer supported in the right position. This causes your neck bones to shift, and the surrounding muscles have to work overtime just to keep your head up. This stiffness in the neck can actually put pressure on your throat, making it harder to breathe. In short, a misaligned jaw can disrupt the very foundation of your body's balance. Throat discomfort can show up in many different ways. For example, turtlenecks or scarves that never used to bother you might suddenly feel tight or suffocating. Or you might feel like there's constantly something stuck in your throat, making you swallow over and over again. Some people even find their breathing becomes shallow, leading to sudden moments of intense shortness of breath or panic. All of these could be SOS signals from issues with your jaw and neck muscles. Don't just brush it off as a minor annoyance. Take a moment to check your symptoms. If you ignore these signs, they can cause significant physical and mental stress, eventually interfering with your daily life. Difficulty swallowing food or drinks, known as dysphagia, is actually closely linked to TMJ disorders. Swallowing involves a complex coordination of many muscles, and at the center of it all is the hyoid bone I mentioned earlier. When your jaw is out of alignment, it throws off the position of the hyoid bone. This causes the muscles to fire at the wrong time, making it hard to swallow smoothly. Have you noticed your voice getting raspy after eating, or do you find yourself choking on water more often? While it's easy to brush these things off as just getting older or feeling under the weather, the root cause is very likely an issue with your jaw joints or muscles. Ignoring trouble swallowing as just a minor annoyance is actually really dangerous. If you keep having trouble, food or bacteria can accidentally get into your lungs, which can lead to aspiration pneumonia. Plus, when eating starts to feel like a chore, you might not get enough nutrients, your strength can drop, and your overall health can really take a hit. Addressing these throat issues isn't just about getting rid of the discomfort you feel right now. It's directly linked to preventing serious illnesses down the road and protecting your long-term health. Realigning your jaw to get your swallowing back on track is a vital step toward living a healthy, happy life every single day. When you're dealing with throat discomfort, the most important thing is not to try and diagnose yourself. There could be many underlying causes, ranging from serious inflammation or tumors to neurological issues or even stress. Your first priority should be seeing a specialist, like an ENT, to rule out any life-threatening conditions. However, if you've had all the tests and everything comes back normal, yet the pain persists, that's when you should consider that your jaw might be the problem. When other doctors can't find anything wrong, it's often a sign that you need a specialized diagnosis from a TMJ expert. At Shinjuku Dental Office, we specialize in TMJ and bite alignment, and we've helped many patients struggling with persistent throat discomfort. Our goal isn't just to provide temporary relief or treat the symptoms. We focus on addressing the root cause, the jaw misalignment that's actually triggering your throat issues. Through a detailed examination, we'll identify exactly what's throwing your body out of balance and create a personalized treatment plan just for you. By bringing your jaw back into its proper position, we can release the tension in your throat muscles and help you get back to feeling like your healthy, natural self. Persistent throat pain, discomfort, or difficulty swallowing can take a heavy toll on both your body and mind. If you've been searching for answers without success, it's time to take that first step toward relief. At Shinjuku Dental Office, we offer personalized consultations to get to the bottom of your symptoms. Through detailed exams and expert analysis, we'll identify the root cause of your throat issues and provide a clear path to ease your worries. Don't wait until it gets worse and starts affecting your daily life. Reach out to us today. You can book your appointment by phone or through our website. We're here to help.